This study is the fourth in a series looking at the point prevalence of burnout and other forms of occupational distress in both U.S. physicians and U.S. workers in other fields. I'm Tate Shanafelt, Professor of Medicine and Chief Wellness Officer at Stanford University. And today I'd like to share with you some thoughts related to our manuscript, Changes in Burnout and Satisfaction with Work-Life Integration in Physicians and the General U.S. Working Population between 2011 and 2020. This manuscript will appear in the March 2022 issue of Mayo Clinic Proceedings. The prior studies looked at the experience of physicians and other workers in 2011, 2014, 2017, and the current paper reports the results from the fall 2020 survey. I would emphasize that study occurred roughly 6 to 9 months into the pandemic is the window when the survey was open. So it really reflects the early experience of physicians during the pandemic. The results were somewhat surprising. At the aggregate level of the whole U.S. workforce, the whole physician workforce across the U.S., the mean scores for burnout actually decreased modestly, and satisfaction with work-life integration increased modestly. I would point out that at that time, in 2020, many areas of the country had not yet experienced their first surge in COVID-related infections. And what we also found was that although the aggregate scores improved, the experience was very different depending on specialty and individualized COVID experiences. So, for example, there was not improvement in scores for emergency room physicians, for ICU physicians, for hospital medicine physicians, or for infectious disease physicians. So those specialties who were really bearing the greatest impact of COVID in the early days did not see the improvement that was observed in other specialties. We also saw that those physicians who had to deliver care without adequate personal protective equipment, those physicians who had suffered disruptive economic consequences from COVID, also were at increased risk for burnout. So the high-level takeaway was that after the first 6 to 9 months of the pandemic, the experience of U.S. physicians was heavily nuanced. And whether your occupational distress increased or decreased depended a great deal on your specific specialty area, your own personal COVID experiences, and then likely other factors like your geography and whether you had yet experienced a surge. I'll maybe just make mention here that another year and a half into the pandemic, my suspicion is that the numbers, the experiences are probably looking quite different. Now that all areas of the country have had multiple surges, all specialties have been impacted in some way or another. And we actually just completed collection of some additional national data to try to shed light on where we are now a bit further on into the pandemic. It also bears mentioning that physicians remain at markedly increased risk for burnout relative to U.S. workers in other fields, about a 40% higher risk of burnout in physicians relative to other workers. And so there still remains a great deal of work to do to try and reduce occupational distress in physicians and the adverse consequences that it has both on individual physicians and their loved ones, as well as on quality of care, access to care, and our ability to serve the communities that we practice in. I would invite you to read this article and consider its findings, both in the context of the last 10 years of physicians' experience, and as well as consider how things might have changed over the year to year and a half since that point in time.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.